to check the patient's medical chart and history, provide privacy, gel in. Hi, my name is Alexis. I'm going to be your student nurse today. We're just going to do a quick abdominal assessment on you. So I'm just going to start by asking you a few questions. Starting off with, can you provide me with your name and date of birth?
Ava Ardondo, 08-18-05.
Okay, and I'm going to confirm that with the name band. So have you had any pain anywhere, any abdominal pain per se?
No.
No. How about any nausea or vomiting?
No.
Any history of abdominal surgeries?
No.
And when was your last bowel movement?
This one.
And what was the color and consistency?
Brown and regular.
Okay. So first what I'm going to do is lift your shirt up, and I'm going to look at your stomach first. I'm just going to inspect it with my light. And I'm going to feel it really quick. It's pink, warm, and dry. I see that it's flat, symmetrical, and I don't see the aortic pulse right now, but I will listen. And now what I'm going to do is listen to your stomach, and you could just breathe in and out through your mouth and nose regularly. I'm going to start with the right lower quadrant, right upper, left upper, left lower. And her bowel sounds are now more active, and now I'm going to start listening to the vascular. I'm going to start with aortic, the renal, the iliac, and femoral. Okay, and I don't hear any bruise. And now I'm going to percuss the abdomen. So I'm just going to be touching your abdomen, and you could just tell me if you have any pain at any time. And this is just checking for dullness and tympany. Okay, now I'm going to actually palpate the abdomen, so you can tell me if you have any pain during this time. Do you have any pain?
No.
Okay. Now you can tell me if you have any pain when I'm doing this, okay? Any pain?
No.
Any pain?
No.
That'd be negative for the Blumberg sign. And now I'm just going to cover the patient. And do you have any questions for me?
No.
Okay, so I'm gonna make sure the rails are up, and I'm gonna make sure her call light's in reach. And if you have any questions, your doctor will be with you shortly, okay? Thank you. We'll be doing the male genitalia area. I'm gonna drill in, and I'm gonna ask the patient a few questions. So, have you had any pain with urination? And the patient said no. Do you have any discharge or odor coming out of the penis? The patient says no. And are you sexually active? The patient says no. So now what I'm going to do with my gloves on is I'm going to palpate the penis, note any lumps, and then I'm also going to palpate the scrotum to make sure that each testes is intact, and I'm also going to palpate the inguinal canal to note any hernias, which I don't see. And now I'm going to cover the patient, and I'm just going to tell the patient some testicular self-exam practice. So if you want to examine yourself at home, what you can do is usually you want to pick a timing that is consistent, which would be like the first of the month. It's easiest to remember, and you want to do it in a shower with warm water so it's easy to feel around in those areas. And while you're examining, if you know any lumps, bumps, or any pain, you can contact your physician immediately, okay? So it was nice to meet you. I'm going to put his his rails up, make sure the call light's in reach, and the doctor will be with you shortly. Now I'm going to be doing the female genital assessment. So first I'm going to be asking the patient a few questions. So I'm going to be asking the patient if she has any pain or discomfort during urination, and her response is no. Does she have any foul odor or any irregular discharge? No. I'm also going to be asking the patient if she is sexually active, which she says yes. I'm also going to ask her, is she on any birth control? No. And have you ever been pregnant? No. If she's had any trouble urinating or urinating frequently during sleep, and her answers are no. So now with that being said, I'm going to uncover the patient and I'm going to palpate the perineum. And I'm going to separate the vaginal orifice and I'm going to ask the patient to bear down so I can see if there's anything abnormal coming out of the vaginal canal, which I don't see. So I'm going to cover the patient back up and I'm going to make sure the rails are up, the coli is in reach, and your doctor will be with you shortly. Thank you.